Hi, my name is Christy Campbell.
And I'm Sean Stanning. We've been together for 10 years and have 3 beautiful sons.
I was at work at a conference and I went to the bathroom and I realized that when I was doing up my belt, I couldn't do it up. And then when I went out of the bathroom, my speech was gone. About half an hour later, all my symptoms were gone. So I went to my family doctor and she faxed something to the hospital and said go home and wait for a call from the hospital for a CAT scan.
That call never came. So we, after a few hours of waiting for a call, we went to the hospital. Christy described what symptoms she had been having, and I described the symptoms that she had been showing to me as well. But it became clear to us fairly early on that the doctor and the interns had pretty much made up their mind within a few seconds of seeing Christy, not really listening to the things that we had to say about the symptoms that she was showing. She was quickly diagnosed with having a migraine and given some pretty heavy sedatives, and after a fairly long day of going through emergency and through her own physician, we just left and she took the sedatives. She continued to have slurred speech. She wasn't really cognizant of where she was, or at least it didn't appear to be. She had slight facial drooping of one side, and she couldn't hold herself up. So she clearly was having a stroke, and I called 911.
I remember the ambulance ride to the hospital, but that's it.
So once we returned to the hospital after I called 911, it took a little while for everybody to figure out, the medical team to figure out why she was having a stroke and what had happened. But fairly shortly after that, it was explained to me that she was having a stroke, that she had had a stroke, and that a significant part of her brain had been affected. The prognosis that was given to me at the time, when Christy was mostly unconscious, was that she would have about 6 months to recover any language deficit that she had, any physical deficit that she had. And so that really set us up for a compressed timeline of recovery. We felt we had about 6 months to get her back to, or get her to whatever level we could, and anything after that was not going to be helpful. So we really worked very diligently over the first 6 months. I think Christy would tell you I pushed her pretty hard.
Yes. And at the 6-month time, I had maybe 12 words. So then I cried because I didn't know what to do if that was it. 12 words. So.
And she still couldn't say her name. So, that 12-month mark, or 6-month mark, was pretty significant. Up until that point, Christy had really taken it as she woke up and these are the cards I'm dealt, and started moving forward with trying to recover the life that she thought she was going to have. But we both cracked at 6 months. That's not how it was supposed to be.
During my time in the hospitals, I felt, well, they didn't talk to me at all. They talked with Sean, talked to my parents, but because I had a communication disorder, I don't know what they think. They thought it was not I was not in the, well, I was in the room, but when they were discussing my case to Sean and my parents, they didn't say anything to me.
And aphasia, while it's a communication disorder and can affect a person's ability to understand language, in Christy's case, that was not the case. So she could understand language, and that had been evaluated fairly early on. So the fact that the medical community was talking above and around her while she was there and clearly able to understand was frustrating to her. From my perspective, I had to maintain a job, so I wasn't around quite a bit during those discussions. So the few discussions that I did have were productive, but a lot of them I wasn't involved in. So at the end of the day, when I would come, my work day, when I would come to visit Christy, she had aphasia. She hadn't been spoken to. She couldn't communicate out to me what had happened during her day. And there was oftentimes, it wasn't the medical staff that was able to, or wasn't there to tell me what had happened during her day, what kind of progress she'd made, what her outlook was for the next few months. So I, like Christy, was kind of in the dark for a substantial portion of it. And hearing secondhand what may have happened from a friend or from a family member that is in and out in the process over the course of several weeks isn't really the same thing as hearing it firsthand from the head physician or the head nurse or head PT that's taking care of the case. And in Christy's case, she's had multiple undergraduate degrees, postgraduate degree, a scientist by training, very capable person to understand the medical jargon that was being presented to her, but it wasn't being presented to her, and B, if it was she was being treated as if her intellect was also affected.
When they did talk to me, I felt that they yelled. My hearing is fine, but because the fact that I couldn't communicate back, I don't know what they think. They thought maybe that getting louder maybe can help. I really don't know.
I think if I could give one piece of advice to people working in healthcare, it would be really to listen. I think up front when Christy had her stroke, I think the signs were there that had people listened maybe differently, it might have been picked up. And also listen to the patient when they're in the room and they may not be able to speak. They certainly have a voice, and whether it be through physical means or other means, that they need to be listened to.
My one thing is just don't tell anybody that they have 6 months to recover or a year. This is their lives, my life. You can always grow. So.
Yeah, putting a limit on recovery, be it realistic or not, be it medically sound or not, really does put limits on people's ability to recover and interpret what they can recover to. So placing limits on things really extracts hope from somebody's recovery, and that's a horrible thing to lose. I think Christy and I would both say that our journey through the medical system, while painful and there was room for improvement, we are blessed to have had it
In Vancouver.